इतना सा फर्क है कुछ होने में और बहुत कुछ होने में। इतना सा फर्क है एक बार सोच के छोड़ देने में और लग के कर दिखाने में। मान लेने में कि जिंदगी ऐसे ही कटेगी और सुबह 4 बजे उठ के सोचने में ये अभी तो बस शुरुआत है। किसी मैगजीन को हाथ में लेने में और उसी मैगजीन के कवर पेज पे होने में इतना सा ही तो फर्क है। वीआईपी सीट में और उसकी पिछली सीट में इतना सा ही तो फर्क है। वो जिसका मैदान ही खुला आसमान है वही कल जमीन पर तो था। पूछोगे तो बताएगा वो पंछी ये एक दायरे में सिमटने में और पूरी दुनिया को दायरा बनाने में बस इतना सा फर्क है। इतना कितना है? इतना है या इतना है? जो नापेगा वो जाने कि जहां धरती और आसमान मिलते हैं, नानकुर से दूर, अगर मगर शायद से दूर, वहां भी दोनों में फर्क बस इतना सा है। धरती और 7वें आसमान में फर्क बस इतना सा है। ये एक अंतर प्रेरणा है। ये हमारी, आपकी, हम सब की अंतर प्रेरणा है। एक कदम, एक छलांग, एक बाजी, एक गहरी सांस और एक ललकार खुली हवाओं में कि हाँ मैं बना हूं उन फिजाओं के लिए, कि हाँ मैं बना हूं उन ऊंचाइयों के लिए जो ऊंची तो बहुत है पर नामुमकिन भी नहीं, क्योंकि मुमकिन और नामुमकिन में बस इतना सा फर्क है। धूप छांव में फर्क बस इतना सा है। तो बस चलिए फ्रेंचाइज इंडिया के साथ ये फर्क मिटा देते हैं। फ्रेंचाइज इंडिया।
Good afternoon, everyone. Thank you for joining us on this webinar of Business Opportunity Over Chai. Business Opportunity Over Chai presented by the management of Franchise India with an aim to introduce you with new business opportunity every day at 12 o'clock. We have a great business opportunity for all of you today into healthcare industry. But before we'll start discussing the brand, let me just quickly run you through with the Q&A process. If you have any questions during the webinar, you can keep sharing all your questions into the Q&A box and we will answer all your questions live in this webinar post our presentation. To make this webinar more interactive, I would request you to keep sharing your queries, interest of city and the questions into the Q&A box and avoid raising hand. Our today's brand is Dubai's leading most proficient home healthcare company, First Response Healthcare. I would like to welcome all the panelists who have joined us here on this webinar today. We do have Mr. Pavan Sharma, who is the MD and CEO at First Response Healthcare. We do have Prachi, who is the technical head. We do have Mr. Mangesh, who is basically heading the franchisee. Along with them, we do have Mr. Balraj Singh, who's heading the franchisee partner from Franchise India, and he and his team is going to connect with you for one-to-one discussion post this webinar. We have Mr. Ashok Kumar, who is a senior consultant and will be helping you in understanding the commercials and the investment part. So now, without taking much time, I would like to request Mr. Pavan to take the lead and tell us more about the brand, as we are very excited to know the brand in detail and about the franchisee opportunities. So over to you, Pavanji.
Yeah, thank you very much, Neha. First of all, thank you very much to Franchise India for giving this opportunity to us. And thank you very much to all the participants who may be probable partners to us for sparing their time and their interest in First Response Healthcare. To begin with, I'll just give my brief. So I'm a healthcare professional from the management side. And I have worked in different verticals of healthcare, starting from pharmaceuticals till the hospital. So it includes your pharmaceutical, pharmacy, diagnostics, hospital, home care, ambulance. So when we started this company in 2018, the main purpose was that we have to create something which is a differentiator, which is a gap in the market. And so we need not to push the numbers, like it has to be a genuine requirement coming from the market. So that is where this first response concept was evolved. Now you just think of a situation like last 10 times when you visited any clinic or hospital, what was the problem? And if you look at last 10 visits to these clinics or hospitals, you will find that maybe 6 to 7 times these problems might have fixed at home. You was not needed to go to a clinic or hospital. Now, when I say this, the need to go to a clinic or a hospital is when you have to do some surgical procedure, when you have to have some critical emergency, or when you have to do some procedures which cannot be done at home. So when I inquire this before starting the company, I think 90% of the people have given this feedback that either they have a fever or constipation or abdominal pain or maybe some cut, wound, stitches, and these all problems can be fixed at home. So the thought was, when food can be delivered at home, why healthcare cannot be delivered at home? So worldwide, home healthcare is known as providing nursing care at home. So when you say any home healthcare company globally, the primary job is to provide a nursing care at home, either to the elderly population or to the discharged patient or to anyone who needs a nursing care at home. Now, although we fall under the home healthcare, but our business is primary care at home. So when we go for the basic problems at clinic and hospitals, this falls under the primary care into the healthcare. So that is why this company, we don't call it as a healthcare at your doorstep. We call it as primary care at doorstep, because that is the biggest gap in the market. Now look at a situation where you have to search for a clinic or a hospital or a doctor. You have to call them to take an appointment. You have to travel, you have to wait. After that, you see a doctor. Now we have solved all this problem, which Prashi will explain in detail. But for all of us, if we can reach to you within few minutes and solve your problem, which is a basic healthcare problem, is the biggest gap in the current market. So the potential is maybe thousands times from now. Currently, we are doing hardly 1% of or less than 1% of the market gap. So the potential is huge, and it exists everywhere globally. You go to any city, this problem exists. So we will take more detail into this. The basic of our concept is that we reach on time very quickly within 30 to 45 minutes. Second, we match the global standards because we are JCI accredited. That accreditation, which is given to most of the reputed hospitals across the globe, around 40,000 hospitals have the quality accreditations to JCI. So we are the first one having doctor on call services with JCI accreditation. So I think the overall thing is that we reach on time, provide quality healthcare, and solve your problem within minutes. And that is the gap, and which we have fulfilled very nicely in Dubai. Now we are taking the help of Frank Global to expand this business model across the globe. So that is the purpose. Now I will request Prashi to take over, and initially we will play a small video, and after that Prashi will take it over. Prashi, to you.
Care, it has no limits, because dedication, empathy, and compassion are endless. In 2018, with a founding team of 16 professionals, First Response Healthcare was established in Dubai with a single vision: to create a world where care is just a call away. In only 4 years, building a clientele of over 300,000 satisfied patients, we've crossed several milestones. But what truly sets us apart is the continued trust of our patients and clients. Today, First Response is a leading provider of on-site healthcare services in Dubai. We're the first healthcare company to be accredited by the Joint Commission International for our doctor on-call services. This global recognition makes us the first preference of both residents and tourists. We're also the first choice of world-class hotels to be their healthcare partners and serve their guests with international standards of care. Due to our robust digital presence, community programs, and CSR activities, healthcare services from First Response are available 24/7 for everyone in just one call, message, or click. We're licensed to offer all essential home healthcare services, ranging from doctor on call to pharmacy at home. Our average response time to reach you is just 26 minutes, from the moment we receive your call until we reach your doorstep. Today, we're a dynamic team of over 200 talented and highly diverse professionals, offering our services in Dubai, Ras Al Khaimah, Abu Dhabi, and Doha, and expanding to Riyadh, Manama, and eventually to the entire Middle East. The global healthcare landscape today is evolving through major technological advancements, and so are we. We are First Response. It is not just our name, it is our promise.
So hello everyone, a very good morning, good afternoon, depending on where you are. I'll be taking you over quickly about what the brand represents, our accomplishments, and what is it exactly that we are trying to solve and how successful we've been at it. So to begin with, I think we must always start with where the problem lies. And as Mr. Pawan rightly explained, through his experience and our management team's experience in the healthcare industry, we identified certain gaps which were plaguing the patients within the healthcare industry. So these problems include the wait times that people had to endure, scheduling the appointments which they would get a day later, 2 days later, where they are sick right now, okay? Then having to travel to the clinic, facing that traffic when you are sick, increased risk of infections because you are coming in contact with other patients. Moreover, even tourists, when they travel, they're not aware of the local healthcare standards, best clinics over there. So all of these things combined with when you finally get to go to the hospital, you kind of have a depersonalized attention from the medical staff because they are so overwhelmed with the critical conditions itself that you kind of just get like 10 minutes with the medical staff and get a standard prescription, move on. So you don't feel that touch or care when you need it the most because you're sick. Post the identification of these problems, we went ahead to do the market research that and like the market validation. Okay, we got to know that there are around 4 billion OPD visits that happen in India every day, similar numbers across the globe, even in USA. And through research, millions of dollars have been spent on research that how home care is evolving, especially post-COVID. And that research has shown that, of course, post-surgery, but even for physician OPD treatments, when you shift that to home, it leads to better clinical outcomes, it leads to better patient satisfaction, and overall, it improves the healthcare infrastructure because your hospitals are better utilized. You know, for medical life-threatening conditions, the hospitals are better utilized, and the patient gets a more personalized care. Therefore, it leads to an overall betterment of the healthcare infrastructure. Moreover, it takes the load of the government to build more hospitals, as well as it solves the problems for the tourists, because as the statistics say, around 40 to 80% of travelers fall sick during their travel. And I think travel is the most vulnerable that a patient can be, because they're in a new city, they don't know where to go, they're not aware of the healthcare standards. And in those cases, there's a gap of an organization which is providing quality healthcare right in their hotels or homes, right? So therefore, it was First Response Healthcare that decided to bring a solution. What exactly is the solution? It is this simple, that any patient anywhere on site, be it a home, a hotel, or an office, just has to call our hotline and share their location, and that's it. Our medical team, which is DHA licensed, health authority licensed professionals, including a doctor, a nurse, and a driver, will be at your doorstep with complete medical equipments, medical treatments, medicines, and the provision for a complete treatment and not just maybe a prescription. So allow me to take you forth through the patient journey that a FRH patient goes through. So once we receive a call from any patient, our first motto is to reach the patient as soon as possible, okay? Because we truly believe that in sickness, your promptness to reach the patient will set you apart in the industry. This was also a market gap because a lot of hospitals which were providing these on-call services also used to take their own sweet time to send or dispatch a medical team. Then we follow proper hospital standards of a consultation, which includes the vitals checkup and what complaints the patient is facing, the investigations, because it's important to identify the right cause according to JCI standards. That is it a bacterial infection, a viral infection, what exactly is plaguing the patient. Based on the investigation, developing a proper treatment plan with the proper consent of the patient, delivering the medicines or administering the medicines, depending on the treatment plan that was developed by the doctor. And finally, the follow-ups as and when needed, because sometimes a patient might be all right in just one visit, sometimes they might need multiple visits. So this is a usual journey that a patient will follow until they're completely fit and satisfied with their treatment. So this is the company, a brief overview about what exactly we stand and represent. I think it is important for me to highlight the vision statement for us, which is to make healthcare services quick and accessible for everyone in the comfort and privacy of their home, hotels, or offices without compromising on the quality of care. I think promptness and the quality are the two main factors which have really set us apart in this domain. Our average turnaround time is 26 minutes. We have managed situations, and our transport facilities, our operations team has managed during COVID, during the recent rains that happened in Dubai, through a multitude of serious hectic situations like the New Year's Eve. So I think over the last 6 years we've really gained expertise on that domain, which is the proper utilization of our resources. Plus we are JCI accredited, so our operations and SOPs have been vetted by an international organization. We maintain all records, right from the patient calls to the final invoicing and the treatment plan completed. As it is regulated by JCI, we have the highest Google reviews, which is 2,500 here in the industry in Dubai, and with the highest rating. Given that we are 24/7, 365 days available, so we never sleep, we are always on the go, be it night or day. We have a commitment to reach you in 30 to 45 minutes. We have a very driven professional team of 200 and more members, and it's only expanding now given our future scope and expansion plans. Also, we are really diverse, so it allows us to cater to different patients, different problems, and overall we are moving to a direction which leads to more geographic expansion as well as technological expansion, which I will cover in the later slides. So now this organization, I think, is truly the brainchild of Mr. Pawan Sharma. I think he has a very profound healthcare experience, as he mentioned, having served diagnostic labs, hospitals, clinics, home healthcare, IVF centers, and not just in India or Middle East, but also Africa. So, covering or looking at the healthcare industry from multiple perspectives, and being an IIM Ahmedabad alumni, I think his vision and his identification of the right gap, which is primary care at your doorstep, is really driving the organization towards fixing a set problem for patients day in and day out while maintaining the quality. Okay, he is very prompt. He ensures to take the organization together so that everyone is aligned with the vision of the organization. And the SOPs that he has set in place back in 2018, which is 6 years earlier, are still continued to this date and has led to the growth of the organization. So I think that was important for me to highlight. Talking about quality, as I mentioned, our two topmost priorities are quality and promptness. As earlier mentioned, JCI is an international accreditation, which is mandatory here in the UAE, at least, for hospitals to get. But to gain the trust of our patients that we are operating at the same quality standards that a hospital would, we decided to take this accreditation in our second year of operations. And mind you, JCI has very strict protocols, SOPs, record maintenance, patient procedures that is to be maintained. They have their audits every 2 years, and you have to renew your accreditation every 2 years. And we were the first one providing this doctor on call and ambulance service provider here in Dubai to get this accreditation because of the SOPs and protocols that were followed right from day one. Okay, now geographical presence, why it is mainly important is because to highlight that we have looked at this business model and the healthcare practices through multiple customer segments and through multiple geographies, and have gained and garnered the experience that this market gap exists everywhere. With the best healthcare infrastructure, with the worst healthcare infrastructure, this gap exists. And we have been operational in Dubai since 2018. We went ahead and opened in Ras Al Khaimah in Dubai, Ras Al Khaimah and Doha in 2022, and finally in Abu Dhabi in 2023, with further plans of expanding to Saudi Arabia and Bahrain by 2025. And by further plans, I mean the licensing and the procedure has already started. Talking about our clinical expertise, which I again think is our topmost priority. Not just doctors, we have a multilingual team of general physicians, pediatricians, paramedics, physiotherapists, nurses. As you can see, that our nurses provide all the treatment at home and not just a prescription. We have a medically equipped bag which consists of all the necessary devices or medicines that the nurses may require for the treatment. Our ambulance services are available for events that happen across Dubai, and physiotherapy at home for any recovering or mobility issues with the patients. Talking about our clinical team, all of our team is really diverse, and all medical team is in-house. We don't outsource our doctors or from other hospitals. This allows us to ensure the quality of treatment that we provide. And given the diverse background, okay, some of these doctors are respected cardiologists in their home country, but here they are serving with us as general physicians and catering to this home healthcare landscape. So we make sure to employ really qualified doctors and to allow us to have a control over the quality of treatment that we provide. Now, supporting this clinical team is the leadership team, the management team, under whose guidance all the operations are maintained, all the business development is maintained. These are professionals with a combined experience of over 100 years in the healthcare industry. So that kind of insights and the action plan that they bring in place is truly what sets the organization apart. And all of these people are, I would say, are really aligned towards the vision statement that I mentioned earlier, and truly believe in the market gap that we are trying to solve. So it is visible in the practices that we follow as well. Talking about our service spectrum, as we mentioned, we have doctor on call, which is our primary aim. We provide DHE licensed doctors, giving complete treatment to patients at homes, hotels, and offices. We have client clinic management. We do have clinics that we operate across Dubai. This is mainly for our clients, our hotel clients, to give them a degree of care which would not be possible otherwise. We also have ambulance services. Our ambulance services are employed with, let's say, Coca-Cola Arena, which is one of the biggest arenas here in Dubai, to maintain and cover all of their events. Moving on, we have physiotherapists and home care nursing, of course, for all the chronically ill patients or someone who has had a surgery. We provide physiotherapists as well as 24 hours or 12 hours deployed nurses at home. Now, supporting our doctor on call services are the lab support and the medicine delivery, because we want to ensure that the complete treatment is done for the patient. We have CAP accredited labs who support us and give us the results, patient results, as quickly as maybe 2 hours, 4 hours. really prompt. And similarly for medicine delivery, under the direction of our doctors, they operate to support our patients. Then we of course have pediatrician on call services. It was important, again, because we know how to take feedback and grow. We realized that childcare was really important for a lot of patients because they would call us for their health. And then when their child would fall sick, they would really request us that, would you have a pediatrician? And that's why we added this service that to allow for that childcare at home. So now imagine you don't have to take your child out. You know how cranky they can be when they are sick. The doctor comes with the right devices and treats your child at home. So again, this is also one of the really important services that we offer. Now, talking about the departments that support these services, we have a complete corporate structure, including our business development, HR, finance, and operations team, who ensure that we have the right funnel of the leads coming in, and then the operations team takes care of those leads and ensure complete patient satisfaction. Talking about the call center, all of our leads, like 80% of them would come through our centralized call center, but we do have other channels, including WhatsApp, website form filling, Instagram, social media, and multiple other channels. We are present on all channels, but this call center, we have really trained our staff to, make the patient feel at ease right from the get-go, right from the moment they call us, because I think the first impression is the last impression. So they feel comfortable waiting for 30 minutes because that's how we have trained the call center staff. And the technology solution that we have equipped for this call center is capable of handling calls from anywhere in the world. So our center in Doha is also maintained through calls coming in this call center. Then, of course, fleet optimization, resource utilization. As I mentioned, operating in very critical situations, we have garnered the experience of utilizing our resources, our fleet in such a way that there is no resource wastage. At the same time, there are no calls that are dropped. At the same time, we are able to maintain our turnaround time through this expertise in the resource management of both our clinical team as well as the transport and operations team. Finally, coming to the backbone, which is the management of our experienced healthcare professionals. As I mentioned, they have put in place the SOPs and protocols that the organization has been following for some time now, and it has only led to the right growth as was expected for the organization. Now, talking about the brand reputation, to quickly mention what we've built and succeeded over in the last 6 years, the entire Dubai hospitality sector really trusts first response for all the medical needs of their guests. And these guests, I'm talking to the likes of celebrities like Anil Kapoor and many other celebrities from different countries that we have catered to. They take us on board exclusively to solve all their medical needs for their guests. And it's important to mention these two particular brands, which is Emaar and Rixos. Emaar is the one managing Address Downtown, which is right next to Burj Khalifa, just for reference. So these brands, exclusive partner for Doctor On Call for Emaar Hospitality since 2019, in fact. For Rixos, we manage not only in Dubai, but also in Doha. We are their exclusive partners. So this is just to highlight the kind of hospitality network or access that we have. And this has only been possible by our promptness and quality that we have mentioned earlier. Again, a list of hotels which are partnered with us as exclusive medical services for their guests. This is in Ras Al Khaimah, this is in Doha, and this is in Abu Dhabi. These are our hotel nurse clinics. Some personal photos especially put in to kind of highlight that we manage their guests fully end to end and not just, just sending a doctor maybe. We have hotel nurse clinics, we have client clinics, and we ensure that we manage all of their medical requirements end to end. Now, within the residential community as well as the hotel community of Dubai, we have conducted multiple, maybe thousands of CSR activity events up till date. And these includes health talks, health screenings, dental checkups, and a lot of community programs training their staff about medical awareness, breast cancer events, and free health checkups. It's really important for, let's say, hospitality staff to maintain their dental hygiene, oral well-being, dress well, look well. So we cater to that as well, awareness about that. BMI, all of those checkups we do regularly to ensure that first response is a name resonating with healthcare, with convenient healthcare, and not just a transactional service. This is a video glimpse. There might be some audio issues, so I'll just quickly move through it after.
Can skip. I think Prashi, we can skip because time is also less.
Okay, fine. Talking about the digital brand, I would really encourage everyone to look up First Response Healthcare online, go to our Google reviews, and see the wonderful words our patients have said about us, which really drives us to continue doing what we are doing. As I mentioned, highest rating and the number of reviews in the industry here in Dubai. Patients have mentioned how we've saved them from feeling really uncomfortable, how we've saved their vacations, how we have, so it really encourages us. And all I'll say is that you should really go and check our Google reviews online. I have mentioned some of them as was possible, but do check it online. You will gain a lot of trust in our organization as well. And I would like to play this video. We have multiple such video testimonials that these patients have willingly shared. I'll just play one of them to just make you understand the quality of care that we deliver.
Hello, this is Patricia Kimura. I was taken care of by Dr. Irkwa when I was at the Ritz in Dubai, in the financial center. I have to categorically and overwhelmingly state she took wonderful care of me. She sat with me. She made sure I was all right. She spent hours and hours of time with me. She checked up on me even after she left. Her team of nurses were absolutely meticulous about how they took care of me and sat with me and put in the IV. And she was very careful about administering all the medication which I received. I work for Greenwich Hospital in Connecticut, Greenwich, Connecticut. And I've never seen medical care to her level of excellence. She was absolutely wonderful. There's nothing I could find fault with. And believe me, I've been treated by and I've seen the care that doctors have given to many, many people. And I don't know if you know, but Greenwich, Connecticut is a very, very wealthy town. And no one there comes close to what she did for me. So I really did appreciate her conscientiousness, her diligence, and her excellent follow-up. She is a wonderful, wonderful, and very gifted doctor. I was very, very privileged and honored and fortunate to have her to take care of me. Thank you.
So, yeah, as I mentioned, the patients really do leave us very kind words, which further motivates and confirms our vision statement, as we mentioned. News articles and multiple, we are very strongly present digitally. I would like to say that across offline and online mediums, we have created a brand that really resonates with patients for all of their home healthcare needs. Yeah. Also, not just patients, but we truly believe that a motivated team will lead to the brand image and the brand outcome that we want. So we ensure to host the grandest of events to ensure that they feel motivated, rewarded, awarded, and recognized for their contribution to the organization. So I would, again, there might be some audio with this there might be some issue with the audio, but please do have a look at it. It's anyway just background music, so it's. So we've held events at the likes of the Atlantis Dubai, the Burj Khalifa itself, awarding our employees with vacations, with Apple products, just to keep them motivated and aligned with the final vision of the organization. So yeah, to basically paint a broader picture, we have a huge scope or a huge path that is still left to a bridge to cover, which includes our mobile app, which is in development to allow for convenient, easy access to all of our healthcare services and to maintain that personal connect with our patients. It includes geographical expansion, as mentioned, moving to covering the entire Middle East as well as the globe eventually. And our service-wise expansion, which includes your dental OPD visits, your dermatology OPD visits, and covering the entire healthcare spectrum, and just a quick at-home healthcare services market post-COVID, it has really seen there has been a boom in the industry, and it is expected to grow at a CAGR of 8.2%. The key drivers do remain that everything today is just quick and at home, with the quick commerce that's coming, your Blinkit, your Zepto. The consumers today really want everything quick and at home because they value convenience, they value time, they value the luxury of services, So there has been a surge in demand for quick services, ranging from your salon to even, of course, healthcare. There is health awareness amongst people due to social media. There is fitness awareness. And post-COVID, there has been a surge in overall at-home services domain. Now, I would request Mr. Magesh to take the franchisee part forward, please. Thank you.
Thank you, Prachi, for giving a detailed insight. Good afternoon, everyone, for joining this event with Franchise Global. First Response welcome you all for participating in this event. Just to give a brief overview on our franchise proposal. So while we are setting up the franchise operations, there are a few basic principles on which we would like to set up our operations. It's going to be a 4-4 model where it will be franchise owned and franchise operated. So the brand guidelines, which would be set by us, which is apparently what we have built over the years and which is again JCI accredited as mentioned by Rashi, we would like to stick to that. We would like to stick to our standards. We would like to stick to our SOPs, and we would also want the franchise who would like to partner with us to ensure that the same standards and guidelines are followed through the operations or through all the other frameworks. So the ownership of the franchise would be by the franchisee. The investment would also be done by the franchisee. The expenses on the investment or the operating cost or the running cost will also be managed by the franchisee, while the operations would be a shared responsibility between the brand as well as the franchisee. The franchisee would own the operational part of the clinical as well as the fleet operation, while the contact center or the customer care, which is the primary source of our operations, which would typically look at hand-holding the patients throughout the journey, will be centrally managed by the brand. The lead generation process, which is apparently working on the social media, connecting with various sources through LinkedIn, through Twitter, through Instagram, or through all the other platforms which are available in the specific geography will also be managed by the brand. So the execution of this, the territorial executive will be for 5 years, which would again be renewable after 5 years. The services would be provided by the franchisee only for the FRH approved services. When I say services, we are referring to the doctor on call, the pediatric on call, the nursing at home, and all the other services. So we have our CRMs and the softwares as illustrated by Rashi in the previous slides, which would be used by the franchisee, which are approved by FRH. So we have our approved softwares, we have our approved CRM solutions, we have our approved vehicle tracking solutions, which we have outsourced, which we have brought from the outsourced partner, as well as we have our in-house applications. The franchisee partner would be sticking to the same platforms so that it is easy for us to manage it centrally from our contact center. So on the overall investment part, what are we looking at? We are looking at an office setup which would have 1,000 square feet with specific parkings for the vehicles. The overall initial investment that the partner will have to incur will be 38 lakhs. The franchise fee, one-time fee would be 20 lakhs. The initial inventory that the franchise will have to procure for running the day-to-day operations will be 5 lakhs. The working capital which would be required by the franchise to run the overall operations over this period of time of 5 years would be around 1 CR. The refundable deposit that would be incurred by the franchise partner as part of the property rental would be around 6 lakhs. Now the brand royalty would be 25%, which would continue for these 5 years. The average return on investment being healthcare would be greater than 100%. We just capped it at 100, but it would be much higher than that. The break-even based on the market that you would be operating will be anything under 2 years. It can be much lower than that as well. And the overall contract period that we would get into at the first term would be around 5 years. Now, who are we looking at? Who would be the perfect fit for the franchise partner would be the financial fit, which would be the ability to invest in the infrastructure and the staff. Now, when we look at the market fitness, we need somebody who has awareness in the healthcare landscape and the hospitality network, as illustrated earlier. One, it is a healthcare. Second, healthcare is split into 2 parts. One is the hotels and the hospitality and the residential segment. So hospitality contributes to good amount of inflow of tourists, and penetrating into that ecosystem is essential for us to scale up this business. Now, the strategic fit is somebody who has an entrepreneurial skill set to propagate the brand value. And the operational fit is to have somebody who can largely run the day-to-day operations, because it's a 24/7, 365-day running operations. So why exactly you should partner with FRH? So one, to join us on the fastest growing healthcare global network. Second, it's a very low investment model to earn the to enter the healthcare segment. We have to learn and collaborate with the team of 300 plus years of experience, 30 plus years of experience, and who have scaled this model from zero to a very large scale model in the last 5 years. Embrace the low risk, high reward franchise opportunity with the proven business model, as illustrated earlier. Leverage the global brand image and the awareness about the first response healthcare. JCI accreditation for a home healthcare is very minimal, and we are proud to say that we are one of those, and we continue to live to those standards. And you can get access to a dedicated training of which will be provided to the entire operating systems within the healthcare. So while you get onboarded with us, we'll give you a full-fledged training of what we have learned, what we have embraced, and what we have fine-tuned in the last 5 years at First Response Healthcare. So the support that you would be getting from the First Response Healthcare, franchise approval and exclusivity to the city. When we say exclusivity, you would be the only partner who would be operating in that specific city or in the specific ecosystem. We would do the interior designing and healthcare fit out assistance, staff training and operational guidelines to fulfill brand objectives, marketing, webinars, and social media management for the franchise. lead generation, including hotel tie-ups and assistance. We have a teleconsultation facility which could give you 24/7 free teleconsultation support. Unique appointment booking app, as mentioned earlier, which we are in the phase of finalizing and developing, along with the existing app, which is an outsource. Centralized call center and technology support, including EMR, which would be an 24/7, 365-degree view of the patient ecosystem and the operational ecosystem. So thank you so much for being part of this journey, where we're able to illustrate as to what exactly we are looking for, and what is our presence so far. I would request Mr. Ashokji to take up from here.
Thank you, Magesh. Thank you, Pawanji and Prasi. I think you have explained the business very well. And second thing, the healthcare industry, I think you are not just only treating the patient, you are also sharing the load of the private hospitals. So these hospitals are overloaded. So I think it is called like sustainable business program, sustainable business model. You take care of your economy, your society, and the environment. So it basically solves all problems in one go. Yes, of course.
One more point I would like to add, which is in the interest of the public, we all have that human responsibility. Today, the healthcare hospital environment is such that, there are business objectives, understand, and most of the population or public understands these things now very clearly, that somebody is going with a malaria, ultimately land up in hospitalization and leading to ICU and all those things. We have very unbiased approach, because we don't have any hospital, we don't have any clinic, we don't have any hidden agenda. Our purpose is to treat the patient in few hours or 1 or 2 days and just go back, understand. Now this all is very well accepted by the patients.
Yeah.
So apart from reducing the government burden on the healthcare ecosystem, the patient interest is also aligned with our approach.
Absolutely. Answer like the business model that you are bringing for the franchisee partners, I think it's a very attractive business model. If you look at the healthcare industry in a clinical sector, if you set up a hospital or a clinic, it requires crores of rupees of investment, and if you are building a hospital, that means it will require at least 1 crore per bed investment. That is the kind of investment required in this industry. So you are solving that problem for primary care, at least that can be treated at home. And for investors, you are bringing a very low investment opportunity, where your initial investment is just 30-40 lakh rupees just to set up the clinic, and you can start your business with 3-4 vehicles.
Yeah.
Right? And you can basically add more vehicles at the later stage as you have more patient inquiry on the daily basis.
Yeah.
Right? But yes, of course, it requires heavy operating expenses.
Yeah.
So you have a staff, then you have your clinic or office space. So those expenses you need to bear. So and if you look at the return on investment, so these are the return on investment is included your working capital. Right, so this in the Magesh that we have shared in one slide, your return on investment is break even is going to be 2 years. So that has been considered on your capex plus your working capital of 1 crore. So at least 1.7 crore it was calculated. But if you look at your return on capex, 60 lakh rupees is hardly in 6 to 8 months you will recover that your capex. Then you are basically capex free. It's just only your working capital that you are keeping in the business and getting profit, right? And if you get your working capital also in 2 years, that means your business is free of investment after 2 years. You are not putting in a single penny in the business to make profit. So business make money for you without any investment, right? And second thing, basically, if you look at the beauty of this business model, the franchisor is giving you the 50% support.
Ashokji, just to give this confidence, so we have seen this in Dubai when we launched in Dubai, that whatever commercials you are highlighting we have achieved those numbers much before that. We have seen it in Ras Al Khaimah, we have seen it in Qatar. Now, after experimenting few locations at our own expenses, we are coming with this model when we have seen that all different locations, countries, geographies have performed in the similar manner. So that means that gap exists everywhere across the globe. That is what is our understanding.
Absolutely, absolutely, sir. And this business model is very attractive for the locations like transit locations where you have like more airports and hospital and sorry hotels. So that's the prime. And second one is your premium societies.
Yes.
So these are the basically targeted audience, and around these markets, this business is very profitable. Right. So, and I think for the audience, Pavanji and his team, they are going to be exhibit in our Franchise India Expo on 18th and 19th. So you have the opportunity to meet the team and take the download, and you can understand the business in much more detail. And after event on 20th and 21st, the team is again here at ITC Dwarka. So we will organize your meetings with Pavanji and his team face to face.
So we will connect to the investors for one-to-one discussion. Mr. Balraj or somebody from our team will reach out to you within today or tomorrow. And we will take the conversation forward. We'll connect you directly with the team of First Response Healthcare. It's a great brand with a wonderful opportunity. So thank you so much for your time to all the panelists. Pavanji, thank you for joining us. Prashi, Mangesh, thank you for coming onto this webinar today. I hope that you all will have a wonderful day ahead. Thank you, Shokji and Balraji, for joining in. Guys, I hope the brand details which we have shared with you in this webinar are going to help you in the understanding of brand in detail. Further, we are going to connect with you, and I have already dropped down the hotline number, which is 9717683838. You can directly write us to feedback@franchiseindia.in if you want to connect with us. I hope you all will have a wonderful day ahead. Thank you so much one more time. Thank you, everybody.
Thank you, everyone. Have a nice day.
Thank you, everyone. Thanks for joining.